come in?
Hi, yeah, you can come in.
Let me just wash my hands for your safety, yeah? I'm gonna be closing your curtain for privacy. My name is Jeff. What I'm gonna be doing is I'm gonna be doing your head to toe assessment. This requires me to touch your skin as well as some other body structure. Would that be okay for you?
Yeah.
Okay. Can you tell me your name and date of birth?
Girly Galario, 010586.
Good. Do you know what day is it today?
Today is Wednesday.
Okay. And do you know where you are right now?
Yes, I'm in the Hawaiian teacher.
Okay, good. And do you know what we're doing for today?
Physical visit.
Good. Okay. So patient is alert and oriented times 4. She knows where she is. She knows her name, date of birth. So she's really oriented. Upon entering the patient's room, I'm examining the general appearance of the patient. She is not tachypnic. There's no respiratory distress. Patient's skin color is even all throughout. She is sitting upright at the examining table. Next thing that I'm going to be assessing is your head. The head is atraumatic and normal cephalic. The hair is black and evenly distributed without any lice, infestations. There's no bumps, there's no lumps. Any pain when I touch? She denies any tenderness to the head area. Facial features is symmetrical, 2 eyes, nose is midline, the mouth is midline, and 2 ears are present without any deformities. I'm gonna ask you to look straight for me. The sclera of the patient is white. I'm gonna be pulling your conjunctiva, yeah? The conjunctiva is pinkish without any discharge. I'm gonna ask you to focus on this finger for me and follow the finger for me without moving your head. Good. Extraocular eye muscle movement is intact, accommodation is intact. I'm gonna be shining light on your eye, okay? Direct and indirect light response is intact. Pupils are equally round, reactive to light. Next thing that I'm gonna be checking is the nose. The nose is midline. What I would expect for the nose is there should be no deviation of the septum, there should be no masses on it, and there should be no epistaxis noted. On the mouth, I'm gonna ask you to say ah. What I would expect is the uvula is midline and not deviated, and when the patient says ah, the uvula rises. The tongue is midline and non-deviated, and the oral mucosa is pinkish and moist. Dentition is intact. Tonsils are non-inflamed. Next thing that I'm gonna ask you to do is I'm gonna ask you to occlude your right ear for me. I'm gonna be whispering a word. Let me know what you hear, okay?
Blue.
Yes. And then the left side.
Table.
Good. So patient's hearing is intact. Next thing that I'm gonna check is I'm gonna be checking the jugular vein distension for the patient. I'm gonna ask you to turn to your left side. Okay. So there's no jugular vein distension for the patient. I'm gonna ask you to look at me again. The trachea is midline and non-deviated. There's no masses or torticollis noted on the neck area. I'm gonna be touching you, okay? I'm gonna be touching you on the major lymph nodes on your neck area. Let me know if there's any pain when I touch. This is the preauricular, postauricular, submandibular, submental, and then anterior cervical, posterior cervical, supraclavicular, and infraclavicular. Was there any pain while I touched?
No.
So there's no tenderness on all the major lymph node and the neck area. Next thing that I'm gonna do is I'm gonna ask you to squeeze my fingers on both sides. Good. I'm gonna ask you to extend your arm for me. I'm gonna put pressure on your arm, try to resist on it, okay? Good. I'm gonna be pulling it up again, try to resist. Good. I'm gonna ask you to move your arm to the side and up. Good. So range of motion to the shoulder is intact. I'm gonna ask you to flex your your elbow and then extend. And then ROM to the elbow bilaterally is intact. Hand grip is 5 out of 5. Next thing that I'm gonna check is the carotid pulse. So carotid pulse is +2 regular rate and rhythm bilaterally. I'm gonna be checking the radial pulse of the patient. Radial pulse bilaterally is +2, equal and symmetrical. Next thing that I'm gonna check is I'm gonna be checking the chest area of the patient. There's no respiratory distress noted, no retraction upon patient's breathing. There's no kyphosis noted, as well as scoliosis noted on the chest, as well as the posterior aspect of the chest. I'm gonna be listening for your lung sounds, yeah? When you feel the stethoscope touching your chest area, take a deep breath for me. Lung sounds is clear bilaterally, anterior and posteriorly. AP diameter is 1:2. Next thing that I'm gonna check is I'm gonna be checking your precordium. Precordium is in your chest area. So there's no heaves or lifts noted. There's no extra pulsation noted on the precordium. Next thing that I'm gonna do is I'm gonna be listening to your heart sound. Just breathe normally. The aortic pulmonic herb, as well as the tricuspid and mitral valve, mitral area is regular with normal S1 and S2. Point of maximal impulse located at the 5th intercostal space on the left side and midclavicular line. There's no extra pulsation to the area. Next thing that we're gonna do is I'm gonna ask you to lay down. I'm gonna be checking your abdomen. At this time, usually what I do is I usually put the shirt off of the patient to check the abdomen. I'm checking if there's any masses to the area, there's any pulsation, especially on the epigastrum of the patient, which the patient does not have. Next thing that I'm gonna do is I'm gonna be listening to your bowel sounds, yeah? There's normal active bowel sounds on all 4 quadrants. I'm gonna be percussing your abdomen. Upon percussing, there's dullness on the right upper quadrant and tympanic on all other quadrants. I'm gonna be putting like a pressure on your abdomen. Let me know if it's painful, okay? Any pain? I'm gonna be doing a deeper palpation. Any pain?
No.
I'm gonna be listening onto your aortic area, abdominal aortic area. There's no bruit in the abdominal aorta. Next thing that we're gonna do is I'm gonna be doing some range of motion on your lower leg, yeah? I'm gonna be lifting your leg up, bending your knee, and then to the side, and then down. Again, up, bending your knee, side, down. Good. Range of motion to the hip, the knee, as well as the lower leg is intact. I'm gonna ask you to put this up for me. Good. And then this one. Good. And then I'm gonna ask you to put this down. Good. This one down. Good. I'm gonna ask you to push on my hand. And then I'm gonna be asking you to put your toes upward towards you. Good. Next thing that I'm gonna do is I'm gonna be checking for the pulses. Dorsalis pedis as well as the posterior tibialis. They're all +2, regular rate and rhythm. Last thing that we're gonna check is I'm gonna ask you to stand back up, yeah? I'm gonna ask you to walk. Then coming back in here, I'm gonna ask you to walk with your toes. Yes. And then walking back there, you're gonna use your heels. Okay, and then come back, and then I want you to close your eyes for me, please. Okay, and then I want you to extend your arm for me, and then close your eyes again. I'm gonna put this down, try to put it back to its original place. And then this one. Good. So Romberg negative as well as the pronator drift test is negative. Patient is walking steadily without any unusual gait imbalances. Hill walking is intact as well as toe walking is intact. That concludes our physical examination. Do you have any concerns?
No.
Good. Thank you so much.